For my section of forensic nurses, I focused on their job as coroners. First, coroner offices mainly receive bodies from accidents, suicides, homicides, or child death. Once at the office, one of the jobs that nurses have is identifying the victims. This is usually more difficult if the victim doesn't have an ID on them, but once the victim is identified, the office will notify family members of the victim's death and confirm their identity. Next, nurses will determine things such as time of death, cause of death, and see if there was anything suspicious in the way the victim died. The nurse may also use past medical history, medications, or use pictures and evidence from the crime scene to piece together and see what caused death. Lastly, if a victim's death is determined to be from natural causes, the office will release the body to a funeral home or do whatever the family wishes to do with the body. Nurses will also write down detailed notes of their finding. These notes will become valuable, especially if the death is determined to be a homicide. These notes may be put to use in trials, and sometimes the nurse may even be called on to discuss their findings in a court setting. This is a quick overview of forensic nurses' jobs as a coroner.
Sexual assault and abuse are crimes that take away a person's humanity and dignity. Victims feel isolated and like there's no way out. They feel hopeless, like no one can help them. And it is a crime that is so common, yet mostly unheard of. People don't want to know what is going on around them or think about the possibility that, statistically speaking, at least one person in their class has experienced some form of abuse or assault. Victims of abuse and assault are all around us. 1 in 5 women and 1 in 71 men will be raped at some point in their lives. 91% of victims of rape and sexual assault are female and 9% are males. In 8 out of 10 cases of rape, the victim knew the perpetrator. Only 12% of child sexual abuse is ever reported to the authorities. And more than 90% of sexual assault victims on college campuses do not report the assault. So, as you can tell from the statistics, sexual assault and abuse is very common, but mostly not reported. That is why sexual assault nurse examiners are so important and so needed, because they enable victims to come forward and fight back. A sexual assault nurse examiner will work in an emergency department or a crisis center for abuse and assault victims. They're going to gather DNA samples and other evidence, like photographs, to provide proof of the assault or abuse, and they can also testify in court as expert witnesses, and they record the patient's statement for the police. Sexual assault nurse examiners are advocates for patients of abuse and assault. They make sure before patients are questioned by the police that they feel safe, and their main concern is for the patient's physical and mental well-being, and making sure that they feel safe before they are questioned by the police. And they're also a bridge between law enforcement and the victim, so they can gather DNA and evidence and statements, as well as being a witness in court, while still looking out for the patient's best interests and not pushing them beyond their comfort zones.
In 1992, at a conference in St. Paul, Minnesota, a group of 72 nurses came together to discuss the importance of their patients and their practice. They discovered that many of them had the same problems: untested rape kits, survivors in need of justice, the need for healing, and a lack of perpetrators being held accountable for their crimes. Although all Americans and most sexual assault nurse examiners, they took a large step and formed a worldwide group to incorporate all forensic nurses. From this, the International Association of Forensic Nurses was born. Forensic nurses became the mediator and advocate to bridge the gap between patients and law enforcement. These nurses knew they needed standards and guidelines to protect their patients, evidence, and themselves. They realized how important their role was in helping protect society. The International Association of Forensic Nurses, or IAFN, provides education and certification for all forensic nurses. Forensic nursing is in its infancy, and things are developing fast. The association meets yearly for a conference where further education and discussion about improvements and changes can take place. The IAFN also provides ethical standards and scope of practice unique to forensic nurses. Forensic nurses have to have a desire for the highest standard of ethical practice. Their scope of ethical practice includes 4 bullet points. The first is fidelity to patients. Forensic nurses have to respect confidentiality, but also advise their patients on the limits of their confidentiality. The second standard is responsibility to the public. Forensic nurses have a professional responsibility to serve the public welfare and recognize their role in preventing violence. The third point is obligation to science. Nurses in this field should dedicate themselves to furthering their education and understanding the limits of their knowledge. One of the most important roles of a forensic nurse is to respect the truth. The fourth standard is dedication to their colleagues. These nurses should perform work honestly and competently. They need to share ideas with their colleagues and give credit for their contributions. They need to support the learning of other nurses in order to promote this field for the betterment of society.
A recent review of elder abuse literature concluded that 1 in 4 elders is at risk of abuse, and the Senate Special Committee on Aging believes that as many as 5 million elderly Americans might be mistreated every year. It is difficult for statistics to be accurate as many cases remain underreported. Advanced age, absence of significant others, poor health, depression, and cognitive, physical, or functional impairment all contribute to victimization. It is very common for female elders to be abused by male perpetrators. Nurses should look for markings that indicate the shape of the object that caused harm, such as a baseball bat. Also, since it is common for children to have bruises, it is important that parents are able to explain the cause of the child's bruises. If a non-ambulatory child displays bruising, this is a definite suspicion. If the elder or child has abuse signs and injuries, the nurse must proceed with institutional guidelines for suspected impersonal violence. It is crucial to rather over-document than under-document to help future legal proceedings. When it comes to questioning, it is important to ask the victim alone, as one of their family members could be the perpetrator. Additionally, the victim should feel at ease when sharing, so the nurse must empathize. For example, with an elder, the nurse can say, "Violence is definitely widespread. I'm going to ask you a few questions that I ask all my patients. Is there anyone you live with that you are afraid of? And when was the last time you were afraid?" Afterwards, the nurse should thank the patient for sharing.